what might we be missing here in the analysis?
Okay, great. Well, it's really great to be on your show. I'm not a television person, so it was interesting hearing your initial introduction. As soon as I got off the line, I'm not going to go to sleep. I'm going to pick up Scott Gottlieb's report. It seems to me to be full of a lot of common sense. I think also I would probably agree with every single word you said. Again, common sense. The numbers we use really go back historically to what was available in China at the end of January. Essentially, the number of cases and the number of deaths. Cases are obviously complicated because it's very hard, different from a case in Israel or perhaps Italy. Cases are not normally defined clinically. They're defined by the presence of the virus on the person who gets sick. Deaths are much clearer. When we got involved in China on the 28th of January, there were already a few hundred deaths. So this is really quite advanced. We're not doing any modeling. We're just simply looking at the numbers and trying to understand what the numbers are telling us.
And Professor, how do we judge the seriousness of the disease? By the number of positive tests? Well, that's a lot of positive tests, or the seriousness of the symptoms of the disease and obviously ultimate death? How do you judge the seriousness of it?
I would, again, I'm not a physician. I'm at a medical school, but I'm not a physician. It seems to me that one problem with the tests, and this is actually maybe not seen as a problem, is that they're very sensitive. And this means that very small amounts of virus can be detected. This means that if we look towards the future where the virus is more spread, almost everyone who dies will die with coronavirus. If you're in a car accident and they test you, they might find coronavirus on you, but you probably didn't die because of coronavirus. So this is an important distinction that I've been trying to make in Israel. In some ways, although Israel is a very small country, I've probably been exposed to a great deal of media attention and examination on this. So I think I would go from, essentially, I think the most important thing are what physicians see in many, many ways. And again, I'm not a physician, but from what I've read, the symptoms that a patient with clinical symptoms of coronavirus have are like fairly advanced influenza. And influenza has been studied a great deal by the US CDC. Numbers are released all the time. Some years have bad influenza, some years have less bad influenza. But essentially, in influenza, a lot of people get the disease. A smaller number show symptoms, a smaller number see a physician, a smaller number go to hospital, and a smaller number die. And I think those are the stages. The trouble is I think that coronavirus is still new, and doctors don't necessarily realize where things are. I think one trouble that I'm seeing is that this really is a very hard problem. I don't think we should underestimate this problem. I would say this problem is, say, on a parallel of designing nuclear weapons in the Second World War. And the sad thing is this problem is being solved on the internet, not in top secrecy, by the smartest people in the world. It makes it very, very hard. Media has become it's not easy to get the ideas across. I think it is a very tough problem. I think all the points you raised are valid, the trade-offs between all these different aspects. The trouble is, let me give you an example of a number that I asked my friends in group recently. If a person is hospitalized with coronavirus, what then is his chance of surviving? If it was influenza, he would have a 90% chance of surviving. That's actually not very good. It means that once you're hospitalized with influenza, and it's usually with pneumonia as a result of influenza, you have about a 10% chance of not surviving. That's high. It's much higher than the things we're seeing. What is that number for coronavirus? Very important also is how important are pre-existing conditions. one thing I've been looking into, and I think that in Corona. So these are difficult issues, and they're not just decided by experts. They're decided by common sense. We need to have dialogue to distill the common sense from this.
Yeah, and Dr. Levitt, we are going to try to get you back on, because these are big issues and big problems, but we're finding that a lot of people, especially in these Italian studies, died with coronavirus, but then a lot of the physicians are saying, we're not even saying necessarily they're dying of it, but with it, because they had so many underlying conditions, which complicates the analysis. Professor Levitt, thank you so much for joining us in the middle of the night from Israel. We really appreciate it.